This is a WGN News special report. The COVID-19 pandemic.
The health cost of this crisis is huge. The COVID-19 pandemic is not just a threat now. Some doctors warn of a secondary health crisis. Surgeons who perform life-changing procedures say there will be long-term consequences to health if the delays in elective operations drag on. Dr. Richard Berger typically performs 1,500 hip and knee replacements a year. In the last 2 weeks, he's done 0.
I have lots of patients who are now suffering because of increased pain because they have to wait.
Most joint replacements are considered elective procedures, which have been suspended to preserve resources for COVID-19 patients.
Right now, we're doing 10 or 20% as many procedures as we normally do. So a dramatic decrease from what we would normally do. And again, I think that's as it should be.
What shouldn't be, patients suffering with pain at home and in isolation. A formula for depression, anxiety, and other mental health issues.
There is a true human toll to those human health issues that's going to be a whole lot harder to measure than the consequences of the virus itself.
It's a secondary health crisis that might bleed into other areas of medicine, says Dr. Benjamin Dome of the American Hip Institute.
If women can't get mammograms, we will see a secondary healthcare crisis. Women with undetected breast cancer. People cannot have their diabetes managed, or can't have their heart disease managed, or can't have preventative cancer screenings. We will see secondary healthcare crises in all of those departments.
The government has issued some guidance allowing doctors to rely on their medical ethics to make treatment decisions on a case-by-case basis. Dr. Dome says he's still performing some surgeries if he and the patient agree it's absolutely necessary in a surgical center, not a hospital.
A patient is the only person who can feel their pain.
For Allison Rudd, pain drove her to have a hip defect repaired last week.
I've been in pain, increasing pain for the last few months. And so, for me, it was something, I had decreased mobility and increased pain every day.
Teresa Wilson's hip replacement was canceled twice as COVID-19 restrictions changed rapidly during March.
So you just realize, it's not that bad. It could be worse.
While patients like Teresa patiently waited out, Dr. Berger says to get back to the regular operating room schedule, his team at Midwest Orthopedics at Rush will add precautionary measures like temperature screenings and rapid COVID-19 testing.
We can do this safely, and I think it's essential to get people out of pain. It's essential to get people moving so they can stay healthy, and it's essential to get people recovered so they can get back to work.
And both doctors say they're concerned about opioid use in patients struggling with pain. That can lead to addiction. Pain also raises blood pressure, which could damage the heart. It's a tough balance. If something goes wrong during a surgery at an off-site facility, the patient will be transferred to a local hospital, potentially putting them at risk for COVID-19 infection.